My name is Sarah Pizzey, and I am a physical therapist, and I specialize in pelvic health.
Pelvic floor PT.
Yeah, I love the education aspect of it. So there's so much that I get to teach patients about their bodies and how this area of your body that you don't really see or a lot of people don't understand. When it comes to being a pelvic PT, my favorite part is educating them about what the pelvic floor is, how it affects their body, and how it's affecting what they're experiencing, whether it's bowel or bladder or sexual dysfunction, that I can be there to help be an ambassador and help people understand what's going on with the symptoms they're experiencing and how we can make them better in the quality of life.
Had prior to becoming an MPT?
Yeah, I worked as a marine mammal trainer, both in the research environment as well as in the entertainment industry. So I did go and work at a theme park in Northern California where I worked for Sea Lion Stadium, and I performed in a show while working with sea lions and harbor seals and Asian small-clawed otters, and occasionally also helped out with the walruses and the dolphins. My favorite part about that job was how much education I got to do about the conservation of these animals and how important they are and how people can really help preserve their environment.
Dream of having as a child?
Well, it's interesting because when I first was growing up, I thought, I want to help people. I didn't know what a physical therapist was, but I thought, I want to help people who are struggling in some way. But then as time went on and I learned more about dolphins and marine mammals, and I thought, wow, that's also really cool stuff. So I thought I want to be an animal trainer, which is what I went on to do. But then obviously I came full circle and came back to the people. So, and now being a physical therapist.
Who is apprehensive to come into pelvic PT?
Oh, that's a good question, because we definitely get a lot of people that are very apprehensive about what are they going to expect? Why on earth did their doctor send them to a physical therapist for a bladder problem? My recommendation is really just come in and talk to us, because at the very least, we're going to have the opportunity to have a conversation about what's going on with you and why physical therapy might work for you. We try to cater to what the patient's comfortable with. Yes, there's a chance that we're going to ask for an internal examination depending on what you're coming in for. I try to be very respectful for the patient, that if they are not comfortable with that, that's definitely not something that we're going to need to do. And we'll try to work on other ways to help evaluate what we need to see.